This is my College of Nursing badge, my student ID. I'm going to scan my surroundings. And I am dressed in USA College of Nursing attire. My shoes. Okay. So first I'm going to obtain my medication administration record, which is my MAR, and my patient order form. So first, I would make sure that when I'm going into the med room, I would have no interruptions, such as phone calls, limit talking to colleagues, and follow my hospital's no interruption policy. So I have my MAR and I have my patient order form. And first, I'm going to verify. So I have Jaguar J. Jones, Jaguar J. Jones. I have his medical record number is 1476352, 1476352. His date of birth is 8/25/1963, 8/25/1963. So I'm going to verify that my medication is morphine sulfate, 5 milligrams, intramuscular, every 4 hours PRN, which is as needed, every 4 hours PRN as needed. For my indication is pain. So I would, for my documentation, all parts of a legal prescription are included. So now for my first check, this is when I'm obtaining my medication in the med room. So my first check, I'm going to start with Jaguar J. Jones, Jaguar J. Jones, medical record number 1417635 4176352. Date of birth 8/25/1963, 8/25/1963. My medication is morphine sulfate, 5 milligrams, intramuscular, every 4 hours as needed, every 4 hours as needed, and my indication is pain. And for documentation, all parts of a legal prescription are included. So now I would obtain my medication, set my order to the side. I'm also going to assess his allergies, and his allergies are penicillin, and on the MAR, his allergies are also penicillin. So I would set my order aside, and now I am going just off of my MAR. So I'm going to obtain my medication. Syringe. So now I would perform hand hygiene, and I would start my second check. I'm comparing my vial, which is morphine, to my MAR. It is morphine sulfate, 10 milligrams per milliliter, 5 milligrams. So I would pull up half of a milliliter into my syringe for 5 milligrams. And the expiration date is 12/20/2025, and it is in date. So first I'm going to use a 3 milliliter syringe with a blunt plastic cannula, and I also have a 23 gauge 1-inch needle. And these are all appropriate for an intramuscular injection. And my MAR does say intramuscular injection. So first, you take alcohol pad, clean my vial. I would take my syringe, blunt cannula, and twist it on. Then I would pull up half a milliliter syringe with air. Going to remove my cap. Obtain my medication. So I'm going to inject the air in the bottle and pull out half of a milliliter of medication. And there is 1/2 a milliliter of medication. So now I'm going to use the scoop method to recap my cannula. And now I'm going to verify my calculations. So I have 5 milligrams of morphine on my MAR, and there is 10 milligrams per milliliter. So I will draw up 1/2 of a milliliter in my syringe, which I did. And it also says it on here. So now I'm gonna make my label. Before I make my label, I'm going to twist off. First, I would check my calculations with another RN, so another nurse, and make sure my calculations are correct because this is a controlled substance drug. So now twist it off in my sharps container and put on my needle. Okay. Now I'm going to create my label for my medication. And making sure I am comparing it to my MAR. We have Jaguar Jones, medical record number of 417-6352. His date of birth is 8/25/1963. The route is intramuscular every 4 hours as needed. And the indication is for pain. So again, I'm just going to check it with my MAR one more time. We have Jaguar J. Jones, medical record number of 417-6352, 417-6352. Date of birth is 8/25/1963. Route is intramuscular, every 4 hours as needed, and the indication is pain. So my documentation, all legal parts of a prescription are included. So here's my label. I'm gonna put it on my syringe making sure that I am not covering where my medication is measured. Okay. So I'm going to perform hand hygiene, don my goggles and my gloves. Well, not my gloves yet. So now we're going to walk into the patient's room. Good morning, Mr. Jones. So I hear you're in pain. I'm here to administer your medication. I'm just going to check your ID band to my MAR. Jaguar J. Jones, Jaguar J. Jones. 417-6352 is your medical record number. 417-6352. And your allergies is penicillin, and it says here, my more, that his allergies are penicillin. Mr. Jones, are there any other allergies I should be aware of? It says no. So now I'm going to start my third check for the 7 rights of medication. Okay. Now I'm checking from my MAR, Jaguar J. Jones, Jaguar J. Jones, my med. I'm going to obtain my vial when I walk into the room. Jaguar J. Jones, Jaguar J. Jones. And comparing to my MAR, medical record number 417-6352, medical record number 417-6352, and this band 417-6352. Okay. The right. My MAR says 5 milligrams of morphine. My label says 5 milligrams of morphine. It says intramuscular. My label says intramuscular every 4 hours. Every 4 hours is needed. Every 4 hours is needed. And the indication is pain. Mr. Jones, can you rate your pain on a scale of 1 to 10? He said 10 out of 10. So the indication for this medication is correct. And for my documentation, all elements of a legal prescription are included. So I'm going to raise my bed to working height, lower down my side rails, and I'm going to position. Mr. Darling, I'm just going to position you to give your morphine sulfate injection in your ventrogluteal, which is the correct site for an intramuscular injection. Just gonna put this out the way. So, have my sharps. Okay. So I'm just gonna take my alcohol pad, cleaning it outward, making sure not go over anything that I've already cleaned. I'm gonna put my corner to mark where I'm going to be injecting. All right, Mr. Jones, so it's just gonna be a little stick. So I'm gonna palpate, make sure it's a good muscle, and it is. So we're going to tap the needle, spread out the skin. We're gonna go at just a little stick, Mr. Jones. 90 degrees. Just gonna make sure to aspirate. And there's no blood drawn up, so I'm free to give the injection. Inject slowly, straight up, straight into the sharps container. And I would apply pressure for 5 seconds to make sure there's no bleeding. Okay. So I'm gonna remove my gloves. Perform hand hygiene. All right, Mr. Jones, I'm just gonna raise your bed back up, put back up your side rails, and get you comfortable. And I'm gonna go to the nurse's station and document how you handled the procedure. And I will be back in about 15 minutes to make sure that you don't have any reactions or your pain, to make sure that your pain has subsided. So I will be back in 15 minutes. Hand hygiene, report to the nurse's station.